Frankincense has a strong anti-inflammatory effect and has a positive effect in many chronic inflammatory diseases such as Crohn's disease, multiple sclerosis, osteoarthritis, and psoriasis. Although frankincense has been used for thousands of years in the healing traditions of many countries, it is now attracting increasing interest from Western scientists. In this video, we explain how to use frankincense and what you should consider when choosing frankincense preparations. By the end of this video, you will know everything about this most amazing plant, so let's get started. Frankincense is a traditional remedy. Frankincense will be familiar to most people primarily from the church. It is smoked in religious ceremonies because it is considered a symbol of purification, worship, prayer, and a sign of God's presence. In many traditions, it expels bad energies, refreshes and improves concentration. Once, incense was also used to cleanse living spaces, not only in the metaphysical sense, but also from germs of disease. However, few people know that frankincense has been used for centuries in the traditional medicine of many countries. The ancient Romans and Greeks used frankincense for wound healing, for example. And in Indian Ayurveda, frankincense has long been considered a remedy for joint ailments. In the 19th century, frankincense was also known in Europe for its pain-relieving effect on joint complaints, but fell into oblivion again. It was not until the 1980s that Western science slowly rediscovered its interest. So speaking of which, where did you hear about frankincense? Let us know in the comments. What is frankincense anyway? Frankincense is the resin of trees of the genus Boswellia, of which there are about 20 to 30 species. Frankincense trees like dry climate. They grow in the Arabian Peninsula, Africa, India, and Pakistan. The best known are Boswellia Serrata, which grows mainly in India and Pakistan, Boswellia sacra, which is mainly smoked and grows in Yemen and Oman, and Boswellia papyrifera from Egypt. To extract frankincense, the bark of the tree is scratched so that the resin emerges. As soon as it comes into contact with oxygen, it begins to dry, and resin drops are formed. These can then be harvested. Finally, an extract is obtained from the resin, which is available in the form of capsules and tablets as dietary supplements and as medicines. What happens to your body if you take frankincense? As mentioned earlier, due to the positive health experiences and the long traditions of frankincense, scientific interest has increased greatly. Frankincense resin has anti-inflammatory, antibacterial, antidepressant, and analgesic ingredients. The species that has been particularly well researched is Boswellia Serrata. So, what active ingredients are in it? Among other things, the various boswellic acids in frankincense resin are responsible for the positive effects on health. The AKBA acid is considered to be particularly effective, which is why it is regarded as the most important ingredient. However, KBA acid is also considered effective. The boswellic acids AKBA and KBA are able to reprogram a pro-inflammatory enzyme in the body so that this enzyme subsequently has an anti-inflammatory effect. Frankincense thus has an effect similar to that of cortisol, which is used to treat a variety of inflammatory or autoimmunological conditions, but has a wide range of side effects. However, frankincense possesses many different other substances, so it can be assumed that this particular cocktail is responsible for the effects. So now we would like to show you the special application areas of frankincense. Stay tuned. Frankincense for joint diseases. In several studies, the intake of Boswellia Serrata frankincense extract in osteoarthritis patients led to reduced joint pain and improved joint function. Doses of 100 to 400 milligrams of boswellic acid daily for at least 4 weeks were used. However, experience has shown that this therapy can be successfully taken for 3 to 6 months. Frankincense for chronic inflammatory bowel disease. Chronic inflammatory bowel disease is very common in modern society. In this case, episodic or continuous inflammation of the intestine occurs. The two most common inflammatory bowel diseases are ulcerative colitis and Crohn's disease. Affected individuals are often dependent on medication for the rest of their lives and may require even surgery. In a clinical study, the standard medications for IBD, which have many side effects, were supplemented with frankincense extract and then slowly phased out over a period of 4 to 6 weeks. Most of the test subjects then noticed an improvement in their well-being. 2 400 mg tablets of frankincense extract were taken 3 times daily in addition to the existing medications. Those were steroids, mesalazine, and azathioprine. As soon as the symptoms, such as abdominal pain and cramps, subsided, the premedication was reduced by 1 tablet weekly until only the frankincense extract was taken. This was eventually reduced to an individual dose depending on how much the subjects needed to maintain the effects. Frankincense for psoriasis. Good experiences have also been made in the treatment of psoriasis. Psoriasis is an inflammatory skin disease, which, just like the above intestinal diseases, belongs to the autoimmune diseases and is therefore not curable from the point of view of conventional medicine. In a clinical study, a frankincense extract cream containing 95% AKBA boswellic acid from Boswellia Serrata was tested on psoriasis patients. The 200 subjects applied the cream to the affected skin areas 3 times a day for 3 months. In before and after images, a marked decrease in psoriasis was observed. In addition, the inflammation markers of the test subjects decreased sharply. The tumor necrosis factor, for example, fell by around 58% and was back at normal levels after the 3 months. Frankincense and multiple sclerosis. Multiple sclerosis is also an inflammatory, relapsing autoimmune disease in which frankincense could be used, as a study from Germany showed. The 28 subjects took frankincense extract as a capsule, 400 mg each, several times a day for 8 months. At the beginning of the study, the individual maximum dose that was tolerated by each individual was determined. This maximum dose was then taken until the end of the 8th month. From the 5th month onwards, magnetic resonance imaging showed, among other things, that the frankincense extract was able to reduce inflammatory disease activity and the relapse rate, and correspondingly increased the quality of life of those affected. 18 of the subjects continued to take the extract voluntarily for up to 3 years. The effect remained even then. Frankincense as a cortisone substitute. Since frankincense has anti-inflammatory, decongestant and analgesic effects similar to cortisone, it is sometimes referred to as a natural cortisone. Cortisone belongs to the group of active substances known as corticoids. In the paragraph on inflammatory bowel disease, we presented a study in which the previous medications for IBD, including corticoids, were slowly phased out with the use of frankincense. The well-being of most subjects improved as a result. Further studies confirmed that the effect of frankincense is comparable to that of cortisone. Cortisone is usually used in one form or another for all the above-mentioned diseases. However, the possible side effects of cortisone are immense. High blood pressure, osteoporosis, weight gain, diabetes problems, thin skin. Cortisone should therefore be used sparingly and not for too long. Frankincense, on the other hand, showed hardly any side effects, as we will show you in a moment. What should you look for when buying, and how should you take frankincense? Frankincense extract is available in the form of dietary supplements and medicines, depending on which country you live in. If there is a standardized medicine, it is best to have it prescribed by your doctor. Many supplements are not standardized, however, I will tell you what to look for. Pay attention to the type of frankincense the extract is made from. Most studies have been done with Boswellia Serrata extract. Pay attention to the dose that a capsule contains. This should be between 300 to 500 milligrams. Be sure to pay attention to the content of boswellic acids. These should be at least 80%, even higher content is better. A very good preparation will also have on the label exactly how much of the two main active ingredients are contained. Pay attention to the consumption recommendations of the preparation or what your doctor tells you, but often you should take 2 to 4 capsules per day, in certain cases even more. This always depends, as mentioned above, on the dose and acid content of your preparation. An important factor: the boswellic acids are fat-soluble. The frankincense capsules should therefore be taken with food or shortly thereafter, because this increases the resorption enormously. Are there any side effects and interactions? Yes, skin redness and stomach intolerance may rarely occur. However, there are no described toxic effects in scientifically studied doses. However, interactions with medications cannot be ruled out. In particular, if you are taking blood thinners, you should avoid frankincense extract, as it may reduce the effect of the blood thinner. That's it for today. We hope you found this information helpful. Speaking of which, if you take or try frankincense, share your experiences with us in the comments. We'd love to learn from you. See you in the next video.